This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs.
So I'd like to invite up Dr. Michael Lipsett. He currently serves as the Chief of the Environmental Health and Investigations Branch at the California Department of Public Health. Prior to becoming the branch chief, he served as the chief of EHIB's Exposure Assessment Section. For approximately 15 years, Dr. Lipsett was responsible for developing the public health and medical foundations for California's ambient air quality standards. He also serves as the lead for California's biomonitoring project, which is measuring flame retardants in a variety of California populations. And he's going to describe his efforts to change California flame retardant rules from within the administration.
Thank you. I'd like to focus on some of the issues that Arlene has discussed from the perspective of somebody within state government. I only have 2 slides. I want to start with this one. This is a slide of BDE 47. This is part of the Penta BDE that Arlene was talking about. This is one of the most bioaccumulative of the congeners, the 209 different PBDEs. And what's remarkable about this slide, as you can see, are the red bars. These are all California bars. The first one that's Bay Area women was a study that was done by Dr. Murto-Petraeus, who's a chemist with our Department of Toxic Substances Control, in collaboration with Dr. Peggy Reynolds' group. This is part from using women from a breast cancer study. The second bar over, so this shows California versus the rest of the U.S. This is from the NHANES data, and you can see as time goes on, you have higher levels. The second from the right is California girls. These are Gale's data from the Signet study. And then finally, the highest levels that you see there are from the Chamacos study. Brenda Eskenazi's group had studying Latino children in the Salinas Valley. Now, one would think that this kind of information would influence government public health policy, and in fact, it has, due to efforts in part of public health advocates, both from inside and outside of government. However, when you have potential policy changes that affect the kinds of major economic interests that Arlene has talked about and that Eliza is going to be talking about in great detail, they have a lot of political juice in Sacramento, and there can be a long lag time before anything happens, and sometimes it never does. And in this instance, you can add into the mix the bureau that's responsible for TB 117, whose longtime staff have an almost religious conviction that their technical bulletin 117 saves lives, that it's really effective, then it makes it much more difficult to try and get things through. So these kinds of rational policy changes become very difficult, and Senator Leno will talk about his struggles to get his colleagues in the legislature to go along with this. And I'd like to just talk a little bit about how this data has been used to at least try to initiate some changes related to PBDEs. So based on this first red bar on the left, the Bay Area women bar, and a number of animal tox studies, and some small-scale biomonitoring that was done by the Environmental Working Group, the California legislature in 2003 banned Penta BDE and one other PBDE called Octa BDE in 2003 with an effective date of 2006. So the US manufacturer voluntarily discontinued its manufacture of Penta in 2004 and 5, not only because of the California ban, but because other jurisdictions, including the European Union, had banned it as well. So problem solved, right? The PBDE were no longer going to be used in consumer products, except there's no money in the bill and for enforcement, and no agency was directed to enforce this particular ban. And then we have, of course, the legacy problem that Arlene talked about too, of 20 plus years of using PBDEs in our couches and chairs. And this issue has never been addressed really by anybody at this point. So we knew we had a serious PBDE problem in California, but the public health community and advocates didn't, at that time, know what it was due to. We didn't know that it was due to TB 117. The California EPA in 2005 set up an interdepartmental work group after Dr. Petraeus and I briefed the secretary of that agency about the PBDE problem in California. This work group came out with a white paper that was posted in 2006 on ways to reduce exposures to PBDEs. This is posted on the website of the Office of Environmental Health Hazard Assessment. It's still there, but because there was no high-level champion for these policy recommendations, most of them have never been implemented. Subsequently, I was fortunate enough to attend one of Arlene's semi-annual flame retardant dilemma presentations, I think it was in early 2007, and found out that it was really TB 117 that was the cause of this problem. And shortly after that, I arranged to meet with the deputy director of one of the Cal EPA departments with the acting head of the Bureau. The Bureau is called the Bureau of Electronic and Appliance Repair, Home Furnishings, and Thermal Insulation. So I'll just call it the Bureau from here on in. So we met with the acting head of the Bureau to talk to her and her staff about the problems of flame retardant exposures that had resulted from their rule. And basically, they said, they stonewalled us. They believed really strongly that they were saving lives and that the rule does not require flame retardants be used, which is true. It doesn't require it explicitly. It's a performance standard, as Arlene mentioned, that the foam can't catch fire when it's suspended above a Bunsen burner, and it doesn't ignite within 12 seconds. I mean, there's a specified distance between the Bunsen burner and the foam. So they said, basically, they absolved themselves from any responsibility from this problem. So we were kind of at a dead end there. And in the legislature, Senator Leno kept trying doggedly to get his colleagues to go along with, to try to change these underlying rules, and he can tell you about his struggles in that regard. In 2009, Senator Leno had what I thought was a great idea, which was, let's start small, a baby steps kind of legislation. We'll focus only on juvenile products, because TB 117, it doesn't affect just furniture, it affects all kinds of infant seating furniture as well, strollers and car seats, these sorts of things. So his idea was it's a no-brainer. This should go through, right? And I thought, this is wonderful. And guess what? He couldn't get the votes to pass it. So at that point, I kind of gave up on the legislature's ability to do anything in this regard. But fortunately, the Bureau had a new acting chief, a guy named Rick Fong, and I cold called him after this, and I explained who I was and what the concerns were, the public health concerns about flame retardants that were resulting from TB 117. He was new to that department, or to the Bureau. He didn't have the same sort of religious fetishism about TB 117, and he was receptive to the idea of setting up an interdepartmental work group with my department, that's the California Department of Public Health, 2 Cal EPA departments, the Department of Justice, the Office of the Fire Marshal, and his Bureau. And we started meeting late in 2009. We met for 6 times over the course of about a year. And we initially started by sharing information. I shared this and many other slides about PBDE toxicology and about the toxicology such as there was about like tris, for example. And at the same time, there were a number of advocates, including Arlene, I have to give her a lot of credit for this, who kept contacting the Bureau and saying, you know, this is a real problem. So it was really something that they were very, very aware of. So ultimately, not everybody at the table was persuaded that TB 117 needed to be changed, but but fortunately, Mr. Fong, the acting chief of the Bureau, was. And we discussed lots of different policy options. But he felt it would be best to start with Senator Leno's concept, focusing only on infant products. And he had a major struggle to persuade people all the way up to the governor's office, okay, that this should be done. So he was able to make the case, and I have to give him a lot of credit for doing this. This was the Schwarzenegger administration. And the Bureau came out with a proposed rule in summer of 2010 and received lots of supportive comments, probably from many of you, from consumers, advocates, enviro groups, and no real opposition from the chemical industry. So the regulation exempting juvenile furniture with explicit exemptions for strollers, infant carriers, and nursing pillows, a major fire hazard, went into effect on December 29th, 2010. And I thought, this is great. We're starting to make some progress here. This is on the 29th of 2010. 2 days later, Mr. Fong called me, and he said, I'm sorry to say that Governor Schwarzenegger has fired me. And he replaced him. This is one of the governor's last acts, was to replace him with basically a political operative who with no background. Fortunately, the Brown administration reversed this appointment within a couple of months, which was great, but didn't fill the position until earlier this year. However, the Brown administration's lead for environmental policy was the supervisor of the person who participated in this interdepartmental work group that I talked to you about. And he was kept well informed about what our work group had been doing. So he was well aware of these issues, and other people, other advocates, some of whom are in this room, also made sure that he was well aware that this is a problem, and he persuaded the governor to change this standard along the lines of what Arlene had said. So he appointed somebody who is really excellent, named Tanya Blood, to head the Bureau, and she has been great in pushing forward this new rule to this new smaller standard. So this should result in a vast reduction of flame retardants. Okay, so the takeaway from this is that the science clearly matters. It played an indispensable role in persuading the legislature to ban penta-BDE and in helping to persuade people within government to work to change the regulation that was responsible for this mess. But clearly, research and even advocacy is not enough. You need to have champions within government who are susceptible and willing to push for these kinds of rules. And I want to just finish. I'm out of time here, but I have one more slide. This is an earlier version of the slide that Arlene showed. And TB 117 went into effect off the left-hand side of this graph when we knew basically nothing about PBDEs. This was from a paper published in 2008. At that time, there were almost 300 papers. You can see the exponential growth. And as Arlene pointed out in her slide, which she's updated, and I also checked on PubMed last night, there are now thousands and thousands of articles on PBDEs. So right now, if you think about the substitute flame retardants that are being used, with the exception of tris, we're on the left-hand side of that graph again. So unless the chemicals management policies in this country change along the lines of what Arlene had said, to take a more precautionary approach, most environmental health research is going to be a rearguard action and having an impact really only hundreds of millions of people have already been exposed. Thanks.